and welcome to our ongoing series on COVID. There is a hue and cry in Uttar Pradesh. Crematoriums are working overtime and bodies are floating in the Ganges, something the foreign media has picked up. To talk about this and much more, we have with us the Health Minister of Uttar Pradesh, Mr. Pratap Singh, who will tell us about this and much more in this edition of HD's talk show, The Interview. Welcome to the show, Mr. Singh, and thank you for being with us.
Thank you.
You are a politician, so let me begin with a political question. How much did the Panchayat polls contribute to the spread of the virus in Uttar Pradesh?
I think the same amount as when all our Pravasi Mazdoors, when they came back from Mumbai, from Maharashtra, from Delhi, from Punjab, from different states at the time of Holi, at the time of the Rabi cutting season, and of course they came back to the Panchayat elections, which is a very major part for all these people, and knowing very well that there would be a lot of infection in these elections, we also went for a massive campaign on the 5th of May, ensuring that 97,000 Gram Panchayats, which are today in UP, special teams which we called Nigrani Samiti, which had a ASHA worker and Anganwadi workers and local officials from the block and from the tehsil to visit each and every village and to see how many people were being infected, providing them with the standard medical kit for 7 days and ensuring that they have that, and also taking back the details of the person who we provided the medical kit to, having it cross-checked by an integrated control and command center at each district level, and to ensure that our RR teams went to those places again, and the names which were given to the RR teams where they had to have test samplings done, those samplings were done by your rapid antigen test or the RT-PCR test.
You agree that these people are sent air tickets and they come back home during Panchayat polls. And of course, Panchayat polls are very important. But at the same time, anticipating this and knowing that this will happen, don't you think you could have taken some steps to stop this coming home or this migration? I mean, I know it's easier said than done, but maybe if not seal the borders, maybe have checking on the borders. So, could you have done something to prevent this?
No, I don't think so this time. Last time, when we went in for a total lockdown in the entire country, then all these measures were initiated by the Prime Minister and his team over there. This time, there was no lockdown. We had to confront our own population and try and do all the testing at the airport, at the bus stations, at the railway stations, and try and contain as much as possible. But also, I'd like to tell you that at that time, the infection was going around at a very fast pace. And in the month of April, we saw this infection moving very fast. Yet, with the High Court's orders, we had to go ahead with this election and complete it by the 30th. So, in a way, we were prepared, knowing that there would be a lot of infection around, that we have to try and see how much infection has spread into the villages, how much it is affecting the people over there. So we did whatever measures we could do in this last 15 days. We have done that.
By your estimate, do you think what you did was enough, or there were many gaps which were left and which could have been plugged?
For any pandemic, no country is prepared, no matter how well developed your hospital facilities are or your system is so well generated. And this is, we are talking of India, we're talking of UP, which has 24 crores of population. And when it came in such a fast way for the last 15-20 days, when we had a terrible time, our beds were running short, oxygen was running short, medicine was running short. Now, this was not only UP, but everywhere around India. We did whatever we could to the best of our ability to ensure that every patient who comes does manage to get inside a hospital, did have some sort of a backup support of an oxygen cylinder, and whatever medicine was offered to given to him, so that he or she, whatever, could sustain himself or herself as much as possible.
Mr. Singh, you spoke about medical facilities and the infrastructure. Let me take you back to what the Allahabad High Court said, and it came down rather strongly on the state government. It said that there are lack of medical facilities and everything is Ram Bharose. I know you will say you will not comment on the courts, but don't you think it is a matter of shame, if I may use a strong word, for the state government to have a court come down so heavily and pass strictures?
As you said, of course, I cannot comment on the court's whatever directions or suggestions or that. But I would like to say one thing more because I also read that entire statement of the court where they came out with this statement saying that why doesn't UP start making its own vaccine? Now, that unfortunately is not possible. A vaccine is made by a pharmaceutical company. So, the idea of saying such things doesn't make much sense. What makes sense is when the High Court did give its comments on the state of the medical facilities in UP by saying it's Ram Bharose, then we have to go from the time of Ram, meaning that from the time of independence, when actually, what I'm trying to tell you is actually we should have spent a lot of money on healthcare from the time we started working on this country. Whichever government comes, I would not comment on any government, but no government has adequately spent enough on creating a good medical infrastructure. When we saw that 2020, when we came in contact with this pandemic, and whatever had happened in 2020, the February 2021 budget has indicated with the Prime Minister's direct intervention that 137% was increased on medical infrastructure, which is equipment, infrastructure, labs, whatever it is. But then again, once this pandemic came in the second time, so we were whatever we had today was not enough at that time. But yet again, from March, we increased in the medical colleges our beds from 8,000 to 18,000, which was just recently. We increased the number of ventilators, ICU, BiPAP machines, all those critical care equipment were increased, medicine was increased. The entire King George Medical University was converted into a COVID hospital. Three-fourths of Sanjay Gandhi Postgraduate Institute, PGI, in Lucknow was converted into COVID hospital. Ram Manohar Lohia, which is also a super specialty, was converted into that. And so, a lot of our own district hospitals were also converted to fully COVID hospital to ensure that no patient would be left out. So, we did whatever we could during that time, improved our services, improved our infrastructure during this entire April to May time. And of course, now the numbers have come down quite a bit. So the whatever oxygen and whatever problems we had has become comfortable now. We have enough space for patients. But of course, I mean, I don't know what the next question will be because everything gets connected from one to another. Because now we are coming into the post-COVID patient situation also, which is also a very serious thing.
You know, you spoke about beds, isolation beds, COVID hospitals, etc. But yet people were dying by the minute. And in that, there was complete lack of preparedness, as I can understand it. And from last year, when you did pretty well, to this year, even the orders which were there were pending or not met. So somewhere, whatever you intended to do was not done. And on the level of delivery, nothing much happened.
See, again, I'll try and put my emphasis on one point is that in a pandemic, anywhere across the world, no government or no country is fully prepared, not knowing what sort of pandemic you're facing. What we faced in 2020 is totally different from what we are facing in 2021 because the virus had mutated. It did not affect people by in the lungs by having this oxygen problem, which was not there in 2020. The problem was that this infection went straight to the lungs, and so everything, the whole ball game changed in this. So when everything changed, then you're facing it like a new virus altogether. And when you're facing a new virus, then you just have to work exactly as it comes.
You know, there are two aspects to this. One, that the anger of the people really was demonstrated during the polls. And the results you can see Ayodhya, Gorakhpur, Varanasi, you know, the BJP did very, very badly. That was one part. The other, even your own MLAs and some MPs wrote to the Chief Minister and said that the situation is very, very bad. There are no medical facilities. And let me quote what Lokendra Pratap Singh from Lakhimpur Kheri wrote, how helpless he was, and he watched people dying for want of critical medical supplies. I have failed to save lives, he said. What would you say about both these aspects?
Definitely, he must have faced a situation like all of us face the same situation, whether you are a politician, whether you are an ordinary man who's looking for a bed, whether you are anybody. We all face the same situation, knowing that what type of pandemic when for one bed, there was a waiting line of almost 50 people to 70 people in a waiting line. Tomorrow, when this pandemic finishes and we are back to normal, whenever this happens, then there will hardly be anybody coming to these areas. I mean, the medical facilities will be there for the normal type of patients which come, which is like for a heart problem, for a kidney problem, liver, whatever, diabetes and different fever, cough. Then normal life will go on, and the same facilities will be lying vacant. So I can accept his anger. I can feel the way he felt, and not only him. There were so many people who are feeling helpless in this situation. Now, if people are angry, there's nothing we can do about it. There's a recovery rate of almost 92% also at the same time. But the people who were not being able to recover, people who did not get oxygen backups at the right time, people who could not make it to the hospital, it is a very sad story, and it is because we have a large population. There's nothing we can do about it. We tried our best to do what is possible. Let the people judge the government. If they are so angry with us, then they will judge us. They have the right to judge us. They will take a decision when the time comes in the next election, and if necessary, a new government will come in.
You know, the panchayat polls actually have shown the anger. And when you say let people judge in the next elections, actually, they have given kind of a judgment this time around also, which has somehow shown the failure of your government.
Yeah, I'll agree to that, definitely. The people's mandate, we have to agree to the people's mandate. If they feel that this is the way they're going to, this is a sort of a judgment to show that the panchayat elections are more uh, anti us, then we are prepared for that, because when the election comes, whenever around the corner in 8 months, 10 months, whenever it comes, we will face it. And whatever decision the people's mandate gives us, whatever decision the people give us, we'll accept it.
Do you feel the government is on a shaky wicket, on a shaky ground at this point in time? And on a scale of 10, where would you assess and how would you assess the performance of the government vis-a-vis Corona and handling the pandemic?
See, I'll put it up to 8, because I know what we've done and how much we've done. But when you have a chief minister who started from last year, set up the team 11, continuously monitoring each and every day at 10 o'clock in the morning, I was part of that, I'm still part of it. And even today, when we brought it down to team 9 with more responsibilities, with more looking at it more clearly, taking more action against officials who are not really putting their heart into this COVID management thing, and suspending them, kicking them out of the service, we did our best whatever we could. So, as I would say that with the chief minister's backing and his leadership, I think we did a pretty good job. And I would say we did, out of 10, we definitely did 8. We may have gone down a bit because of the lack of certain beds and lack of oxygen at that time, because it was a very big crisis, and it was all over India.
Is it true that the team of 11, as it is called, failed to assess the needs, the medical needs of the second surge? Equally, it is true that if they said, please give 100 beds, the CM would say, take 200. But somewhere it is the failure of the team which did not assess the need, the requirement, and the urgency which the second surge would demand. And hence, the messy situation that UP has been in has been because of the failure of this team.
No, first of all, you must understand that Team 11 is basically to organize all the fallout of the COVID-19 situation also. It is not only the hospital infrastructure or the testing or the medicine, it's not only that. Team 11 also looks at the fallout like industrial workers, people who are not being able to work, whether they have hospitals over there, whether the companies were giving them, whether they were having help desks that were there, ensuring they give them food and this thing, if they get sick, giving the family something.
But
Yeah.
the medical facilities also are part of their domain. There they fail to flag the need.
No, how can you predict that a second wave is coming in a different form? Every day we have to change our guideline, allow people who are showing negative, yet they are considered presumptive COVID patients. We allowed them to be admitted, given them the treatment accordingly. And now we have a post COVID problem because now, after 15 days, 20 days, 25 days also, later people are coming in with all sorts of again infection because of different medicine
But
fallouts and all that. So
yeah,
we face it every day.
but Mr. Singh, the basics were, whatever the form of the mutant, whatever the form of the variant, the basics were required and they should have been in place. Basic a hospital requires is ventilator, oxygen, beds. So you didn't have to wait for what kind of a mutant, but these should have been there in place. Having said that, the fact that from team 11, now it has come to team 9 also indicates that something was amiss with Team 11.
No, we made it more systematic or comprehensive, one would say. Team 9 has now been, instead of having two other officers who used to come regularly on there, we reduced them and amalgamated them with the different departments altogether.
So you won't agree that the rejig from Team 11 to Team 9 had something to do with performance and kind of a failure and not being able to deliver.
No, I would not agree to it as a failure. It was streamlined more, and to make it more accountability, make it more efficient, it became more streamlined. I would put it in that sort of way. But no. But if you're asking me time and again how much UP government was actually not prepared, I would say the world was not prepared. I would say the whole country was not prepared. And so UP also comes into the same setback.
The COVID command center experiment failed. There was a lot of red tape. People were running from pillar to post. Would you, as health minister, agree that this was an experiment which went horribly wrong?
See, I'll tell you something about that. When all these hospitals get attached to the government, I mean your private medical college, apart from the government one, private medical colleges, private hospitals which had converted themselves for dedicated COVID care, they all came under one umbrella under the Integrated Control and Command Center, where we had a proper digital platform where each hospital was supposed to tell us that we have so many vacant beds, so many HDU beds, so many oxygen beds, so many ventilator beds. On that basis, the critical care of the patient, or depending on the condition of the patient, we were allotting them bed. A sort of a control over all those hospitals, knowing कि कौन सा खाली है, कौन सा नहीं खाली, तो आप उनको augmented करें. So they wouldn't back out from that. Eventually, when this pressure came to us, then we agreed to sort of disband this whole system. Today, we've allowed them that 90% of the private hospital, whether it's a corporate hospital, whether it's a private dedicated hospital, they can take patients directly. 10% will be kept with us so that in case somebody needs to come, we'll just ask them, you keep 10% beds for us. If there's an emergency, we'll allow them. Same things with the government medical colleges and government hospitals also. So, okay, so fine, whatever it was, we disbanded that.
So you would agree that you learnt on the job.
We are always learning on the job. I agree with you. We are always learning. And we learn through our mistakes.
You spoke about vaccinations. Now, the pace of the vaccinations initially was very, very good. And you were administering about 3.17 lakh doses per day. But now it has dipped to only 1.78 lakh per day. What is the reason? Is it vaccine shortage or is it something else?
Simply vaccine shortage, because if you see the overall picture of vaccination, in the country we've already vaccinated 20 crore plus people. Now, when two companies were shortlisted by the Government of India and ICMR, their manufacturing capacity, even today, everybody knows that Serum Institute makes 6 crores vaccine in a month, and Bharat Biotech makes about 1 crore a month. Now, with this calculation, the Government of India, when they started on 16th of February, they started with health workers, knowing that they are the people who have to first serve the people in the hospital, frontline workers, 60 plus people, then 45 with 20 types of comorbidities, then 45 plus. Now, all this went smoothly because you had that much of stock, your calculation was right, and we were supplying each and every state with that. So, whatever was given to us, we continued with that. And now the 18 plus, because we have to buy from our own resources. The government of India has clearly said that this you have to buy from your own resources. So we approached both the companies because that is the only company which is available in India. Both companies were not being able to give us that much of supply. Whatever little they gave us from 1st of May, we started in the high case load of 7 districts. When they gave us little more, we added 11 districts more, and then we added 5 districts more. So at the moment, 18 to 45, we are doing in about 23 districts, and we've done about 7 lakhs 50,000, something like that, approximately. Overall, we've done about 1 crore 80 lakhs totally
Yeah.
so far. But this has gone slow, obviously, because we are not getting any supplies. We floated a global tender also.
There was a lot of wild wastage. Initially, it was about 10%, and now, of course, it has come down to 3%. Don't you think that has also contributed to the shortage of vaccines?
You're right. There was a little bit of wastage, which we put a lot of emphasis on because what was happening was initially people who lined up over there, when we started the walk-in sort of, people allowed them to walk in also during the 45 plus. At that time, there was a bit of a little slip-ups in some ways where people were not coming either, or even now, like 45 plus the second dose, before it has been changed now, Covishield to say about 3 months or something like that. But people who came in, they were not coming in enough numbers, and so if about 5 people came and yet you had to open a pack, so then 5 would go wasted. So there was a problem in that, but now we've absolutely streamlined it and controlled it because the first time we are doing vaccination in such a huge way. So there are problems sometimes.
The state government has floated global tenders, as you said, for the vaccine, which is a very good thing. But let me ask you that in those global tenders, if bids are made by Chinese companies, as a nationalist, would you allow them to sell vaccine to you?
No, that's an easy reply I can give you because 12th of May was our pre-bid qualification where we didn't see any Chinese participants coming in that way. So if they had come in the pre-bid qualification, which is always there in any tender, then we would have made conditions accordingly to that. But since nobody came from that side, and it was only other companies which came in or had showed a bit of interest and all that, so I don't think we had a problem with that.
If they did come in, would you have allowed them?
No, I don't think it allowed them.
That's what I expected. So I thought I'd ask.
On the WHO praise, which the government has been flagging, actually it's very controversial. Because one view is that the WHO, which was partnering with the state government, merely mentioned what was happening on the ground. The state government picked it up, misinterpreted, willfully, accidentally, by design, and showed it and touted it and flagged it as praise, while the ground reality was very different.
See, I think we have our health partners, which is WHO and UNICEF. And there's one or two other health partners internationally. Bill, Melinda Gates are also there, BMGF. So these health partners are always there in some form or the other in every district. They help us in assessing as to the system which we've generated, how much actually work is going on. Now this time, because we had to go into the villages in a very large way, and we had to create these Nigrani Samitis, which, as I told you, were part of the ASHA worker and the Anganwadi worker and local your block level officials and all that. Now, that was basically to touch each and every village in the state, which is 97,000 gram panchayats, and to ensure and to verify or rather identify those sort of patients who have these sort of symptoms like COVID type symptoms, give them the medical kits, and also take the feedback of the symptomatic patient, get them to be sampled also by the RR team, and also to find out actually whether they got this or not, the medical kits or not, whether they actually went to those villages also. So this was a cross-checking system which we used our health partners, our own people also, plus our health partners who were in the field. They used to come and tell us where we were going wrong or where we had not reached. And when they saw that we had been reaching most of the places and we improved each day, we keep improving, then they must have given their comments or whatever you're saying. But we started this movement because we needed to reach each and every village. And for us, they are very helpful in the nature, because then they can also tell us where our workers are actually working or not working.
You said the WHO must have done it or may have done it. Are you aware of what it said and was it actually praised? Because what people are saying is that the UP government just picked up a mention and is trying to sell it as praise of the UP model.
No, I have not read the WHO report. As you mentioned that they just commented on a certain area. I don't know. I have not read that. And then, okay, if they have commented or doesn't comment, eventually it is we who have to do the work. We don't need the WHO or the UNICEF or anybody else telling us that where you've gone wrong or anything, or that you've done a fantastic job and all that. Eventually, it is our citizen over there. Eventually, the person who is going to become a COVID positive patient or a super spreader, we need to identify that particular person in the village, ensure that he is treated properly with the medicines or taken to a hospital, and also make sure that he is contactable by everybody else, whoever the system in the team is. So eventually, it is our responsibility. I would not say that, okay, if somebody comments on us and gives us a very good hands up and says like you've done a damn good job, okay, fine. We are not trying to sell it or anything like that.
Mr. Singh, that's very fair. I think the government information department needs to learn and take some lessons from you on this because they are the ones who are touting this, if I may use the word, as praise of WHO.
No problem. I mean, we are here, we are doing our work. As I told you, people who are unhappy with us will give us a different mandate. If they are happy with us, we'll come back. It cannot be connected to any sort of politics in this. It is like everybody's support we need.
What is the real story about bodies floating in the Ganges? You know, the foreign media has been going to town over it, and India is shamed. The state government has also stopped the Jal Prabha. Would you set the record straight?
People died in their own homes. Now, when people die in the home, and what normally happens, you die of a particular disease. Let's say in any other disease you die, then the people of the family people go and bury the body over there. They don't do the antim sanskar like by fire or anything like that. They bury the body if you have a particular type of disease and all that. Now, this I've come across so many people who I spoke to that in their own house they had a body which was there, yet their own family people would not pick them up and take them for Antim Sanskar. They were people who were just rushing to the ghats and then burying them in the sand or putting in the river, which was a totally wrong thing. And by the time the pictures came out, by the time we got to know also, strict supervision was put on all the rivers of UP, whatever rivers we have. So people somehow did not understand this virus. They took it as lightly as possible, and then people died in their own home. And there were a lot of places where families did not take them. In fact, other people had to take them and leave them over there or bury them in the sand, which was a wrong thing.
So they threw the bodies in the river.
Yeah, some people threw them in the river and some were buried in the sand only. Then later on, they were taken out, and then about as much as possible, the last rites were performed.
So initially, bodies were floating in the Ganges.
Yeah, yes.
There is a mismatch between official figures of death and those in crematoriums. And let me give you one figure. Between April 16th and May 5th, officially 196 people died in Kanpur. But data from 7 crematoriums there showed about 8,000 cremations. I know you will say these were not corona, but surely the mismatch is there.
Number one, the records which we show, portal or our data which shows every day, is the deaths which are in medical colleges, private hospitals, dedicated COVID hospitals. Every death which takes place in these institutions or hospitals are meant to upload their numbers immediately onto the portal, which comes to us in the early morning and which we assess. Also, there's a death audit which is done on each and every death, but that is in these hospital institutions. Number one. Number two, in this COVID pandemic, during the time which I said the 20 days when people were unable to get beds, also, a lot of people who are at home were trying all sorts of medicines or trying to get oxygen and were not being able to get oxygen or died at their home were then taken to the cremation site and then they were also given. Those numbers are not accounted for. Those numbers don't come to us because we don't know how many people died in homes. where their own guardians took them to the cremation site and buried them. What we do know is that at that time, they were, apart from this, as you said, I will say that thing also, that apart from COVID deaths, there were non-COVID deaths also. There were old elderly people who are suffering from cancer, elderly people, natural diseases, accidents. We have a lot of accidents, UP, on the roads and all that, so they are also there. But the mismatch will always be there because COVID patients who died in the home, and there's no identification whether they were COVID or not, but they died for whatever reason, taken to the ghats, cremated over there, along with the official numbers going there. So it must have been a lot of numbers which were coming up at those times.
Isn't the gap very wide? 196 officially and 8,000 unofficially?
Those figures I wouldn't know because I only deal with the state figures. So I'm not too sure what Kanpur, what cremation figures they're showing, and what sort of things or that. That I wouldn't be able to comment on.
You spoke about testing, but the numbers are low simply because you were depending on the rapid antigen tests and not the RT-PCR. And the rapid antigen tests always or mostly show up false negatives.
We started with one lab in 2020 from King George Medical University, which used to RT-PCR lab, which used to give us 70 to 72 tests, which had to be confirmed by NIV Pune. Those were days we started. And we built up our lab system in all the medical colleges and certain hospitals up to 125. And we were doing at that time also in 2020, during that COVID pandemic time, we were doing about 35 to 40,000 RT-PCR tests, after which we started the RAT, the rapid antigen test, we started getting it in large numbers. This time, again, we've already doubled the capacity of RT-PCR. That is also under the central government's guideline. And we are doing 1,24,000 as of today, RT-PCR only. And also we are doing rapid antigen tests, the rest of it, and we're doing up to 3 lakhs per day, out of which 124 is RT-PCR. The rest is TrueNat and CBNat and antigen tests. Altogether put, we're doing about almost 3 lakhs a day we are testing now.
So in the first week of May, 2,20,000 tests only, out of which 74,000 were RT-PCR. The rest were rapid antigen, which is 1,90,000. Now that is why the numbers are probably low, because the false negatives were coming up. So that was my point actually.
Also, the government of India's guidelines started coming in that you can start using rapid antigen tests also. If it shows true positive, then it is considered positive. If it shows negative and the person is not symptomatic, you don't need to have a RT-PCR test then at that time. That was new guidelines which started coming in. So we started doing that only. And in the villages, we started doing rapid antigen tests to ensure that if a positive comes positive, we'll agree to that. We don't need to do his RT-PCR. But if there's a possibility that the person is symptomatic and it is showing negative, then we'll do his RT-PCR. But that was in the time from April itself, we started doubling our capacity, getting new machines in all our medical colleges. And today, I think maybe another 15 days or maybe 20 days, you'll see our capacity going up to almost, I think, 150 or 170 or 150 or 170 types of RT-PCR tests now at this time.
You're preparing for the third wave, and which is very good. But at the same time, even while you're putting in equipment in place, oxygen, ventilators, beds, all that is there, but the manpower is not there. People are not willing to come and work. How will you combat that challenge?
Third wave is not sure as to what form it will come. We've only been hearing from the scientists so far that there's possibility affecting people from 18 below or 12 and below, children who may be sort of infected by this COVID symptom.
Yes.
So whatever is going around in the scientific world, then we started getting our pediatric ICUs back into shape. Along with the equipment, we'll have doctors, which we are trying to get from now only, have them trained for different sort of diseases, and to make sure that we'll be ready by at least end of June.
So you don't feel there will be a challenge as far as manpower is concerned?
No, I don't think so. I think we'll be able to manage for the time being. We'll manage.
Mrs. Priyanka Gandhi has made several suggestions. In fact, she has written to the Chief Minister and spoken about people-friendly prices to be fixed. She's spoken about compensation to those who were overcharged and so on and so forth. Would the state government do something about this, or would you dismiss even good suggestions simply because they are coming from the Congress and the opposition?
No, we already knew in the last phase also we found a lot of private hospitals who were overcharging or taking advance from patients. Even then, I remember in the last thing, I had 4 cases filed against 4 hospitals in Lucknow itself. This time also we clamped down on them, and another 4-5 complaints have come in, and not only in Lucknow, but in, say, I think in Meerut, in Bulandshahr, in different parts of the state. Whenever we're getting a complaint, we are having an inquiry done and putting a FIR on them and ensuring that they return the money.
So do we take it that you're working on Mrs. Priyanka Gandhi's suggestions?
No, I won't say it that way. She is most welcome to give a suggestion, and she has given a suggestion to the Chief Minister. But as I said, we've already been doing it since last year, and we are continuing doing it this year also. And she must have very good ideas. I'm sure. I wish her well, and I hope she comes back into this, comes to the state this time in full power, and then she can use all her brains to develop this UP also in a big way.
Mr. Singh, you're talking like a congressman that you hope she comes back to power.
No, no, why not? I mean, every party, see, as I told you, it's the people's mandate. You never know who the people will give a chance or opportunity to anybody.
Mr. Jay Pratap Singh, thank you very much for your time. This has indeed been a very informative session.
Thank you very much, ma'am. Thank you.